As we know that Indonesia is the largest country in the Southeast Asian region with 250 million inhabitants, the prevalence of infectious disease in this country is quite high. We conducted a study in evaluation of clinical assessments and microbiological findings among hospitalized adults with CEP. The British and American Thoracic Society (BTS or ATS) have indicated that the treatment and the organisms causing CEP were based on study published in 2003 from high-income countries. Local epidemiology may vary by country. Studying among lower middle-income countries is more challenging. The prevalence in Indonesia was 4% in 2018, but no available published data relates to the mortality yet. This study is to evaluate the clinical and microbiological appearance among hospitalized pneumonia patients, focusing on multidrug resistance and risk factors for mortality in a referral hospital in Indonesia. We assessed the antibiotic susceptibility and also assessed the clinical manifestation, the day 3 clinical improvement, and 14-day mortality. In the results, we got 202 isolates, 181 were with antimicrobial susceptibility data. Among single agent causing CEP, Streptococcus viridans for gram-positive bacteria and Acinetobacter baumannii for gram-negative bacteria are predominant pathogens. They are roughly 19% and 70% respectively. However, in overall, Streptococcus pneumonia was the most prevalent pathogen causing CEP, or 18%. Of all identified bacteria, 44 were MDR organisms, or 22%, of which Acinetobacter baumannii demonstrated to be the most prevalent pathogens among MDR isolates, or 6% of all identified cultures. We look at the susceptibility test. Ciprofloxacin and amoxicillin had the lowest potential efficacy of antibiotic against MDR organisms, or 0.9%. The recommendation from the results: the third cephalosporins antibiotics such as ceftriaxone, ceftazidime, and cefoperazone remains high sensitive for kinds of MDR bacteria. To assess the risk factor for mortality, we perform multivariate analysis. From bivariate analysis, they were significantly different with respect to cardiovascular diseases, neoplasm, diabetes mellitus, alkalis 3 or above, day 3 improvement, infected with MDR organism, and the combination use of antibiotics. In multivariate analysis among patients' factors, patients with neoplasm and those with alkalis 3 or above had a significantly increased risk of mortality with odds ratio 2.79 and 9.19 respectively. Clinical improvement at day 3 appeared to provide protection with odds ratio 0.06. In conclusion, 1/5 of causative agents among hospitalized CEP cases were identified as MDR organisms. The pathogens of MDR and non-MDR CEP remain susceptible to the third generation of cephalosporins, together with additional consideration of culture findings and PSI assessment. A 3-day clinical assessment is essential to predict the prognosis of 14-day mortality.